both the United States and Canada, over 4.5 million people need blood each year. Sadly, blood centers struggle to supply hospitals with ample amounts of blood to save those injured patients. All over the world, there is a high demand for available blood, and that problem is not really improving. For instance, in Canada, patients have been sent home early with drugs as an unhealthy alternative to blood because of their short supply. So what can be done to fix this global crisis? Researchers are attempting to develop synthetic blood as an alternative, but the process is rather lengthy and very costly. In addition to the physical requirements, there are emotional factors contributing to the global shortage of blood that can be more easily changed. When referring to the major factors contributing to the global blood shortage, there are strict physical requirements that eliminate a large portion of the population. At the most basic standard, donors are required to weigh at least 110 pounds, be at least 17 years of age, and be in generally good health. While some may think these requirements seem unreasonable, it is the responsibility of hospitals, blood collection centers, and blood storage facilities to protect the health of those donating blood. So unless you can medically guarantee the safety of those donors who fail to meet the predetermined requirements, then there is really little to argue. It would be remarkable if every person could donate blood safely, but there are very few methods that are both effective and affordable. Thus, other viable alternatives must be sought out to fix this shortage. The people who have never donated blood may have preconceived thoughts on the process that are untrue. For some, imagining a needle piercing your skin can evoke fear, which may result in the avoidance of donating blood. Though, unknown to some, the process of donating blood is rather uneventful and actually quite relaxing. The medical staff at blood centers are excessive in ensuring the care and comfort of the donor throughout the whole process. From personal experience, the big scary needle only causes around 3 seconds of minor discomfort. After the stick, the donor simply sits and relaxes in a comfortable chair for close to 10 minutes while the blood is collected. Without previous experience, there is no reason to assume the donation process is painful, though the best and really only way to overcome that fear is to experience the process firsthand. There would be a remarkable increase in donations if only half of those people overcame their fear. But while fear obstructs a person's willingness to donate blood, there are other factors that are just as influential. If you were to ask any random person whether they are aware of the global blood shortage, most would claim they are. Surprisingly, with so many people aware of the problem, little is being done to fix it. According to a United States survey, 17% of non-donors cite never thought about it as the main reason for not giving, while 15% say they are too busy. People find it hard to will themselves to donate when they consider other activities to be more important. With the struggling economy, it is even harder for people to worry about others when the focus is mostly on their own selves. Aside from the economic downturn, events like holidays, college midterms, or anything that demands special attention can cause blood donations to be put off till later. The best solution to that problem is to simply remind them of the importance of donating blood. Just imagine a friend asking for your help to move furniture. Normally, you would volunteer. Now, on the other hand, you would not just randomly tell your friend that you are there to help move his furniture. Similarly, you would not give blood unless someone explained the beneficial importance. Some people are skeptical and may refuse to donate when you ask, so you must be persistent. If you constantly bring about the same subject, then eventually the person may comply. While personal confrontation can convince a person to donate blood, rewarding incentives may attract even more people. As if the feeling of accomplishment and knowing that you have done something good is not enough to donate blood, some people can be drawn by rewards for their donation. Blood centers already supply the donors with refreshments following the process, but some people need even more incentive to come. Aside from voluntary donors, there are paid donors who receive money from blood banks for their donations. The American Red Cross, personally, should develop more innovative ways of attracting people to increase the available blood supply. For instance, they could work with insurance agencies to allow for lower medical insurance rates for those who donate. Using money as an incentive can really create a variety of ways to attract new donors. Ideally, it'd be great for everyone to donate simply out of generosity, but this is not an ideal world, and some people need motives for their actions. Hopefully, For those who have never given blood, you have come to the realization that these factors very well contribute to your avoidance in donating. Even better, now some of you may understand that those preventative factors are quite easy to overcome, which should result in a newfound willingness to donate. Through one donation, you have only given up 1 hour of your time in return for saving several lives. And for those who fail to meet the physical requirements to donate blood, you still have a dynamic role in fixing this global shortage, because sometimes it only takes a bit of encouragement to will others to donate. Regardless to whether or not there is an increase in available blood, all donations are greatly needed and greatly appreciated. Though, after enhancing your knowledge of the blood process and recognizing the influential factors contributing to the shortage, there should, hopefully, be no reason to not help save a life.